Good evening, everyone. Welcome to the Back to School Health and Wellness event. We have a panel of experts here for you tonight, hosted by Supervisor David Halbert. We have representatives from the City of Fremont, Alameda County, Fremont Unified School District. And with that being said, I will let you know that, introduce myself. I'm Kathy Kimberlin. I work for Supervisor Halbert. I'm the field director, mostly representing the City of Fremont, connecting the supervisor with all things Fremont. And I would like to next introduce the supervisor to greet you all and say a few words to you tonight. Supervisor, it's all yours.
Well, thank you, Kathy, and thank you all for attending this virtual meeting. And if any of your friends missed it, I want you to know it is being recorded, will be placed out on various YouTube channels, on my district website, on Facebook. So take notes, but if you don't get all the notes, you can watch a replay. Also, the valuable information that will be shared, the slides and details and data will be emailed to you if you registered for this event. So you don't have to take all the notes. You will get an email of these notes. And again, all the details available online in the future. I would like to also thank in advance all of our panelists. I know that we recently went back to school, and that always means an exciting time. Even traffic patterns around the city changes in the morning and in the afternoon for drop off and pickup. And back to school, the first day, I know it's often mom's favorite day of the year, right? And with COVID happening again now for the third year, if you recall, back in March of 2020, that was the tail end of the 2019-2020 school year. COVID lingered on to the 2020 and 21 school year. We're now in the third school year that is affected by the COVID pandemic, 2021-22. And I know that causes a lot of stress, a lot of angst, a lot of anxiousness. And what are we going to do? How are we going to get through this? Well, that's why we have on the call here, the Fremont Unified School District, just to make sure that everyone knows, what the protocols are. It's also important that we recognize, and we do, that this causes stress and the need for wellness and mental health, and just a chance to talk about the resources that we have provided by the county Office of Ed, Fremont Unified School District, our own district office. And we act as much of a connector to resources and a collaborator and a place to call and talk if you need help. The supervisor's main job is to help improve the quality of life for the people in the county of Alameda, in my district, District 1, and Fremont is a big part of that. Everyone knows that the county supervisors are in charge of safety net health providing for people that don't have main health insurance. And we know that there are children in the district and people in the community that need health care that don't have insurance. The county is responsible for that, but the county does so much more. During the pandemic, we're operating emergency food needs. We're helping to curb homelessness where we can. We're providing mental health services, which you'll hear about later today. County supervisors and county offices do a whole lot, again, to help make lives easier for our constituents. So with that said, I'm proud to be able to offer this resource to you tonight. And I'll just say thank you in advance. There will be time for questions and answers at the end. And other than that, Kathy, thank you for all that you've done. Take it away.
Thank you, Supervisor. Next up, we're going to hear from Becca Prager. She represents the Alameda County Healthcare Services Agency. She's a school-based clinical manager.
Great. Thank you so much, Supervisor, and thank you so much, Kathy. Yes, my name is Becca Prager. I work with the Healthcare Services Agency of Alameda County, and we are really dedicated also to supporting the health and well-being of you and your families. Next slide, please. So I wanted to share just a little bit of student wellness data in California from this last year, which we are really seeing reflected in Alameda County as well. In the last year, anxiety, depression, and suicidal behavior are on the rise. And what I want to share mostly today are some resources and some ways that you can access those resources. And we will be sharing this PowerPoint later so that you'll have all the links for everything for supports during this time. Next slide, please. So there are many contributing factors to the health and wellness of young people, and of course to us as adults as well. And COVID, shelter in place, and distance learning has deepened these factors in this last year. And these factors can include everything from race, gender, sexual orientation, unmet basic needs, institutional racism, inequity, insufficient access to physical and mental health services, and insurance. Next slide. So this is what I really want to focus on. So I want to just say right away that if anyone is experiencing a crisis or concerned about your own safety or the safety of your children, to immediately call Crisis Support Services of Alameda County. The number is right here, bolded. They are available 24/7, and it's 1-800-273-8255. And I would like to share, it's like a 3-pager of really key resources for you all in Alameda County. Kathy, could you click on the Alameda County resources link, please? Okay, great. This is actually a different one, but that's great. This one is around COVID-19 resources through Alameda County Public Health. And here you will find resources around food, housing, mental health, wildfire and heat. And in the mental health resources, you will find things for you as parents, agencies that you can call, and mental health and coping during COVID-19. And so let's go back to the main slide.
Okay, let's see if I can do
In
that.
the slideshow, that's totally fine. And I'm really just wanting to make sure people see this and then can go back to it when it's shared with them. So yeah, if you go up to the top with the copy of Board of Supervisors, District 1 Back to School, if you just click on that link.
And I'm not seeing that, so let me recalibrate.
Oh yeah, no worry at all. We are all getting used to Zoom navigation.
Okay, we are here. We are. There we go.
Thank you so much. And I'll just say, we don't have to hop over to the other link. The first link, the Alameda County Resources, also has set out really clear resources. And the CDC also compiled parental resource kit for COVID-19 in particular. So these are all accessible and available. Next slide, please. So we work really closely in all of the school districts in Alameda County, and you'll be hearing about this more from the school district, but the focus is really on providing a 3-tiered system of support, with tier 1 being universal supports for all students. So that's things like assemblies and field trip days, etc. The second tier is targeted for some students at risk. So that's, smaller life skills groups, building healthy relationships groups, etc. And then tier 3 is really focused in on individualized support for a few students who might need more intensive support. So this is just to give this frame as we go into talking about schools in a little bit. Thank you so much.
Thank you, Becca. We are now up next. We have Mayor Lily May.
Hi, good
There you
afternoon. Thank you so much for the opportunity to come and talk about this important topic. And certainly when it comes to health and wellness, this is something that's near and dear to our community. And in fact, we are very pleased as working very close in partnership with the school district and also with our city resources. And I'm glad that you'll be hearing from some of our dedicated care providers and our team leaders in our city. It's been a really important partnership now more than ever, not just in the physical health, but in mental health and wellness. And so I'm very pleased that we've been able to continue some of these programs. It's everything from teaching our youth about good diet and in terms of healthy relationships. We've emphasized things like creating awareness of teen dating and violence to things like mental health. And we've been able to continue, even in these COVID time periods, to provide outlets for our students to express themselves through our virtual art contest. And I will be happy to share some of those slides and links. And then also tailoring some of this to our families and providing resources such as family counseling and parenting classes, which I think our team will be sharing later as we go on. And finally, when we also talk about wellness, I'm really proud of our youth and the activeness of our community members, especially our commissioners. They've worked on creating awareness in particular for things like warning signs for substance abuse and the concerns with vaping. So they've been great partnerships with us to allow us to share about what are the concerns, what are the warning signs, and how to build a healthy relationship. Finally, in closing, I wanted to share that this is not just one of many different partnerships that we share. We work closely with our healthcare providers such as Kaiser, Washington Hospital, and Sutter Health. We are creating efforts in terms of awareness such as equity in terms of delivery of healthcare. And we are one of the National League of Cities of Opportunity this year. So again, thank you for this opportunity to share about this critical issue and how we as a city can partner with our local educational institutions, healthcare institutions to ensure physical health, fiscal health, and mental health in these challenging times. And I look forward to be able to have conversations with all of you and hopefully answer any questions that arise. Thank you so much.
Thank you so much, Mayor May, for being here tonight. You've supported school things, city things for many, many years, and your time is precious and you share it generously. And so thank you for your words tonight and your information. And if you have links or slides you'd like to share with me, I will send it out afterwards. Thank you so much. Next, we will be hearing from our Fremont Unified Superintendent, CJ Kamek. CJ, take it away, please.
Thank you very much, Kathy, and thank you very much to the supervisor for putting on this forum. I'm CJ Kamek, and it is my distinct privilege to serve as the superintendent of Fremont Unified School District. It is evident through mountains and mountains of research. We know that the more connected students are to school, the better they do overall. And that's not just about their academics, it's about their social emotional well-being. And so we know how critical that connection is to school. And coming off a pandemic year where the predominant experience for everyone was distance learning, we knew that as we entered this year, our focus had to be on reconnecting and restarting with relationships at the foundation of everything that we do. So that's been a big part of our return to campus this year, is refocusing on relationships, reestablishing those relationships. And we're very grateful to the city of Fremont and to the county for their support and their partnership. We have our Director of Student Support Services, Mr. Greg Bailey, who later in the forum will be sharing a lot of the tangible steps that we're taking to support the needs of our students and ultimately our staff as well. And I just want to extend my gratitude and thanks to all of our teachers, our administrators, and our classified support staff. As we reopened all of our campuses this year and welcomed 33,000 students, 33,000 plus students back to our schools, there was a lot of joy And of course, there was a lot of tension as well. It had been a while since kids and staff had been on campus. But in visiting as many schools as I have during the first 20 days of the school year, the one common theme that has continually arisen for us is how excited students are to be back. When I talk with students, whether it was kindergartners, whether it was ninth graders, or whether it was middle schoolers, and I ask them, how do they feel about wearing a mask? How do they feel about different protocols and changes in their routine? They described it a little bit differently, but they all had the common theme that none of that seemed like much of an obstacle as long as it meant that they got to see their friends in person. They got to be back with their teachers and back in the school environment. And so I think, if anything, that the pandemic has really highlighted how critically important public school systems are to the success of a community and to the success of the youth that that community is there to support. And it's also highlighted the importance of the relationships that we need to build and continue to have across different agencies, from the school district to the city to the county. And I think tonight will serve as a great example of how that tangible teamwork makes a difference in a school district, and more importantly, in a community. And I am so grateful for the work of our team, the patience of our families, and the courage of our students. They are an incredible group of people, and I'm motivated every time I talk to each one of them. So it's a pleasure to be here, and I look forward to being a part of the event. Thank you.
Thank you for your time, Superintendent Kamick. You are everywhere all day long, and your time is precious as well. Appreciate you being here and supporting this event tonight very much.
My pleasure.
So next up, we're going to hear from Fremont Unified, Greg Bailey, and also from the city of Fremont, Annie Bailey. There's a lot of connectivity, collaboration, and partnership that goes on between the city of Fremont and Fremont Unified, which I'm very proud to say and very happy to say that they work very closely. We all work very closely together, and let's hear what you have to tell us tonight.
Thank you very much, Kathy, and it's a privilege to be here tonight. I would like to also thank the supervisor for giving this opportunity to share some of the things we're doing with our school district and with the city of Fremont and other organizations in our city. So thank you very much for giving us this opportunity. I have about 3 slides that I'm going to share, and then the 4th slide, myself and Annie Bailey from the city will do it jointly, because those are some of the things we work on jointly together. But first, I want to talk about what we've done to prepare ourselves for the 21-22 school year coming back. As the supervisor said, this is our 3rd year. Roughly, our students haven't been on campus for roughly almost 18 months. So we wanted to make sure we were prepared, that our staffs were prepared, and more importantly, that our parents and guardians and community felt safe having their students return under our guidance. The one thing we did in early August is we had a trauma-informed practices training, and that was held for all of our sites. It was actually held at Ohlone College in Newark. Each of our sites have an elementary liaison, or at the secondary schools, they have what we call the re-engagement specialist. And that day was really focused on some trauma-informed practices at the beginning half of the day. And then at the second half of the day, the either liaison or re-engagement specialist work hand in hand with the principals to come up with a plan and how this would be shared with all of their staff when all the staffs returned. Another thing that I'm extremely excited and proud of our school board for hiring additional staff when it comes to assist our students with some mental health struggles that they might be facing. Years ago, we brought in elementary counselors, and they were at our sites either 2 days a week or 3 days a week. The school board made a huge commitment to make sure that all of our elementary schools, which is 28, have a 1.0 or full-time counselor at each of our sites to build consistency and to build a plan for students TK through 6. And then at our middle schools, we have 3 counselors. Our junior highs, we have 2. And then our high schools, we have anywhere from 4 to 5 full-time counselors. The school board also took action to hire some social workers for our district. These are 2 new positions in our district, and we're looking forward to really build a program with our social workers. Our counselors at our sites are continuing to provide mental health awareness to our students, staff, and our communities at large. And another thing we are extremely proud of, and this is really happening with the supervisor's money. So once again, we appreciate that partnership. We've established wellness centers at 3 of our high schools, which is American, Irvington, and Washington. American and Washington really established it last year during distance learning. So even though they've had the wellness center for over a year, this is the first time really with students being on campus. This year, our focus is on the 3 remaining high schools, which is Kennedy, Mission, and Robertson, to have them start building a wellness center where students could go throughout the day to talk to a therapist if something is bothering them. Some of them are having group therapy sessions if needed, also in these wellness centers. Another thing we did is restorative practices. That was done in August before school started. That opportunity was given to all of our secondary teachers. It was done by the International Institute of Restorative Practice, better known as IIRP. It was a 2-day training, 2 full days, and we had well over 200 participants during that 2-day training. We have received nothing but positive feedback from that training, so much to say that we're thinking about doing it again next summer for the teachers who were not able to attend for a variety of reasons. One of the focuses on those 2 days was, how do we welcome students back? We went over a lot of circle, they call it circle, on how to get students reacquainted with each other, to go over classroom norms and expectations as a whole class, instead of just having that teacher decide what those procedures and norms are in a classroom. And then for our elementary sites, we are embarking on a journey with PBIS, which is a positive behavior interventions and supports. All of our schools across the district, 28 of them, are at different segments of where they are in that process. Some were in year 1 and some were in year 3. It's typically a 3-year process before we could say a school site is really PBIS with students, parents, and staff all involved. Next slide, Kathy, please. Another thing we have done is we have youth mentors at 18 of our sites. A youth mentor really works with our students without permanent housing or our homeless students and foster youths. We have at least monthly check-ins with the students. We provide backpacks, food, clothing, BART tickets, AC transit tickets, Chromebooks, anything that they need. Our youth mentors are our connection with all the sites with this. One of the things we're extremely proud of our COSS team. COSS stands for Coordination of Services Team. Each site has a well-functioned COSS team where we're meeting about students, as we mentioned before, in tier 2 or tier 3, and how those students move in between those tiers to make sure that we have supports in place for the student and family if needed. We also partnered this year with ACOE for youth mental health first aid training. We had such an interest from our staff that we had to have our own Fremont Unified School Day sessions. We were fortunate enough that we worked with ACOE and they accommodated that with us. We were able to have 2 full sessions, and sessions were capped at 25. So we had more than 50 people who were interested that were able to go through that training with ACOE on mental health first aid training. And what we found out that it was a lot of our office staff who sometimes get left out of some of the trainings. They probably benefited the most from it on what was trained during that 1-day session. We also provided, LivingWorks provided training on suicide prevention. It was a very in-depth training. It was about 40 hours of self-paced, all online training that majority of our counseling staff took part of, as well as some of our teaching staff. The one thing we are continually trying to build on is our SEL, which is our social emotional learning. We are having a meeting with the curriculum instruction and student support services regularly on the progress of this. And we hope to have a TK through 12 program by the end of this year. We also have expanded our DSET team. Our DSET team stands for our District Crisis Intervention Team. We have a mobile team that will respond to a site after critical incident has occurred. We have added 7 new members, so we have a total of 14 members on that team. And these members are either psychologists, counselors, or administrators throughout our district. And there are unfortunately situations where we do have to arrive on campus with the DSET team to make sure our students and staff are supported during that crisis. And then Care Solace is something that we brought on that helps our families navigate our families to find a licensed therapist for a variety of reasons, not only mental health, but it could also be for substance abuse. And that service is also available to all of our staffs at FUSD. Next slide, please. Thank you, Kathy. And then some of the community organizations that we do partner with. I wish I could spend the next hour on how positive this is, but I'm going to try to keep it as short as possible. One we work with is the Hume Center, and they really provide workshops through the South Asian Community Health Promotion Services, and they provide direct mental health services to our students through their school-based program. EBAC, better known as East Bay Agency for Children, once again, it operates through our Fremont Healthy Start Center, and they really deal with case management. They help families navigate to healthcare insurance and service supports. They also do interpretations and translations for us. Bay Area Community Health, or BAC, does quite a bit for us. We've had a very long-standing working relationship with BAC. It used to be Tri-City. They have changed their name. One of the things they do is they provide a medical mobile clinic for our students who are missing immunizations. They will either go to the school sites on particular days or at the district office. They also provide direct services to assist our students who might be struggling with some mental health issues at that time. And then last but not least is SAVE Alternatives to Violent Environments. It provides presentations on healthy relationships for our secondary students. That is happening mainly in our health classes throughout our secondary schools. Next slide. And this is the last slide, but Ms. Bailey and myself will be doing this slide together. One thing, we work very closely with the city in Fremont. We've had a great relationship. We meet, we talk on the phone. We have many meetings to discuss how can we work together for our communities. The one thing that I really want to highlight is the alternative to suspension. A couple of years ago, the city actually reached out to the district and noticed that they had an opportunity to work with us, with our students who might have been being suspended for unfortunately using vaping. We saw the big problem with that. So what we decided to do, in lieu of suspending the students will go to a 3 or 4 week program with the city of Fremont. The city of Fremont uses the Y Tribe program to talk about making better decisions. Also, we also coordinate a little bit with the police department on that, because at that last meeting, the police department will do a presentation to the parents about the negative consequences that vaping could do to the students' health. And then if it doesn't improve, unfortunately, what it might be happening to them when it comes to the legality of vaping when they are considered a minor still. And then I'll hand it off to Annie for the next one.
Thank you, Greg. And thank you again, Supervisor Halbert and Kathy, for putting on this panel presentation that we think will be really, really helpful to parents and community members at a challenging time. So continuing on with the partnership discussion. Yes, Greg and I and our colleagues at the school district and the city partner very closely every year. And work together to design and develop programs that meet the needs of our students and families. One of the ways that we've done this over the years, over actually more than 15 years, is to develop a school-based mental health program called Healthy Choices. And Healthy Choices meets a significant need among students and their family members for mental health support, as well as on-site crisis intervention. Through this program, we're able to provide a robust clinical training program for up-and-coming healthcare workers, behavioral healthcare workers, including students who are getting their master's degrees as well as their PhDs that my colleague Joyce Lim will speak to shortly. But the Healthy Choices School-Based Counseling Program essentially deploys skilled and educated graduate students into the schools to help support the mental health needs among students and their family members.
Thank you. And another thing, as I mentioned in the prior slide, our cost meetings, we have a very robust cost program with all of our sites have a functional cost team. The city of Fremont is actually a really valuable member of those cost teams. They provide supports. They provide feedback to our sites that will support the students. And they really help us link the students to the proper resources that we might be limited on our end with the district. That's when the city really comes in and says, oh, this is what we can do. We could assist with that. So they are extremely valuable member of all of our cost meetings. They're not, I wish they could go to all of our cost meetings where we have hundreds and hundreds a year. But when a site could get somebody from the city there, it is a huge bonus for the site. But more importantly, it's for the parent and student that might need some assistance.
Yes, and then also attendance of school review board meetings. That's another way in which we partner with the school district. The city has staff who attend the meetings that are scheduled to address the attendance challenges that some of our students are having. And in these cases, we would come together with a team of people, a multidisciplinary team of people who are there to support the parents and students with understanding what are causing some of the attendance challenges or problems, and also identifying any particular needs that student has, with the goal of trying to increase their attendance and help them be successful in their the academic environment. The school attendance review board meetings are scheduled in advance each year, and the city is essentially scheduled to attend those and deploys either social workers from our Family Resource Center or clinical counselors from Youth and Family Services.
Thank you. And as Mayor May mentioned earlier about the mental health, wellness, and stigma reduction, I think this has really been a big push with the city for a number of years yet. I think one of the highlights for me is when we have the art competition, and just normally in the springtime. And in some cases, I'm able to judge the entries. And I'm always impressed when we see student work on what they produce at a variety of levels. When I talk about levels, I mean grade levels. But more importantly, what they're trying to really get that stigma reduction of mental health. So it's one of our most enjoyable events that we do. Even though I am out many nights, that is one night I do not try to avoid, because I think it's such a positive thing of having that collaboration with the district and the city and the students providing work. When you see the joy of the parents on some of the submissions that their children have done, it's just a fantastic event. I would invite everyone who's watching this, if they could, to join us at that event. The city does a fantastic job of hosting it and providing a show for us with all the work displayed. They even make books. I have the book still in my office of all the art entries. So that is a wonderful event. And FUSD is very fortunate to collaborate with the city on that.
Thank you, Greg. Yes, we've enjoyed that collaboration and think that your students are amazing. So you've got some very talented children in our district and young adults. So in addition to serving the children and the young students and the adolescents in the district, we know that it's really important to support parents. The children are not going to be successful if their parents are not feeling competent and successful in their role as a parent. So one of the ways that we've partnered with the school district to do this is offer parent support groups and parent education. We created a parent support group during the COVID pandemic crisis and have offered twice weekly support groups virtually to parents in English and Spanish. And the school district helps us promote those support groups. So we feel it's really important to support parents, to provide them with information, resources, and also connect them with other parents so that they can gain that sense of community and learn from one another.
And then also really close to that is to professional training that the city provides for parents, staff. It's amazing. And one of the things I want to say, they're also are included in some of our counselor meetings. I believe they're going to the next counselor meeting with our new counselors will be present, where the city goes over all the resources available that they could share with our families, and more importantly, answer any questions that any of our counselors provide. So we try to include the city in Fremont in all the activities that they could be helpful in. So I want to thank once again the supervisor for giving me the opportunity. I'm now going to give it back over to Kathy Kimberlin, who we miss at Fremont Unified School District.
And I miss you, but Fremont Unified's in my heart. You can't take it away. Thank you, Greg, for your leadership as the Student Support Services Director. You've been doing that for quite a few years now, and each year it gets better. Your leadership is valued and appreciated. Now, I think next we are going to hear a little bit. I'm going to do a little time check here just for our panelists so we can all check in and be sure we have enough time to hear everything. It is 6:40. Our event ends at 7 p.m. We still are going to hear from the Youth and Family Services, City of Fremont. We're also going to hear from the County Behavioral Health Services. So we have plenty of time for all of you, but I just wanted to do a brief reminder of our time check. So next we have Annie Bailey and Joyce Lim, and I will share my screen once again. Welcome.
Thank you, Kathy. So again, my name is Annie Bailey. I'm the Youth and Family Services Administrator, which is the Youth and Family Services is one of the divisions of the Human Services Department. The Human Services Department works to support a vibrant community in collaboration with government, education, and nonprofit agencies. We do this through the creation and maintenance of services that empower individuals, strengthen families, and encourage self-sufficiency, as well as enhance neighborhoods and foster a high quality of life in the city. We also serve Newark and Union City. The department provides behavioral health care and social safety net services for thousands of seniors, adults, families, and children, 0 or birth to 21 years. Today, Joyce Lim and I will be presenting on behalf of Youth and Family Services and the Family Resource Center. Next slide. Oh, I'm sorry, Kathy, if you can go back to Behavioral Health Care Services, I apologize. So Youth and Family Services was founded over 40 years ago, primarily as a youth delinquency prevention program. And we're one of the founding members of Alameda County Probation Department's Delinquency Prevention Network. Over the decades, the division has evolved to become a contracted provider of behavioral health care services, providing mental health, crisis intervention, and substance use treatment counseling to children, transitional age youth, young adults, and families. In addition to individual and group family services, the division, in partnership with the city's Family Resource Center, provides family support, case management services, and linkage to a myriad of health, social, and financial services. We serve low income and those living in poverty in particular. We have a staff of 12 counselors, licensed counselors, as well as a couple dozen clinical interns. And we partner closely with Fremont Unified School District to deploy these services. Next slide. Joyce.
Okay. So the way that we have increased our service capacities to support Fremont schools is through our well-established and reputable clinical training program. We establish formal training field placement agreements for master and doctorate level students with the accredited universities, whether it's in California or even out of state. Our intern selection process is based not only on applicants' aptitude and interest for youth and family mental health work, but also if they are well matched culturally and linguistically with our student population. For this school year, we recruit 16 clinical interns with diverse cultural background. Some of them are also bilingual, which helps with our connection with families who speak Spanish, Mandarin, Hindi, Kannada, Marathi, Tamil, Tagalog, and Turkish. Among the 16 interns, 4 are placed in the clinic and 12 are assigned to our Healthy Choices school-based counseling program. The Fremont schools that participate in the Healthy Choices program are listed in the table on this slide. There are 6 elementary schools, 2 junior high schools, 4 high schools, and 1 charter school joining this year's program. Our YFS interns stationed at the assigned school site 2 days a week for 10 hours each week. Service provided through this Healthy Choices school-based counseling program are free of charge, offered right at the school site, so to reduce any access barriers to the mental health services. And with parental consent, we provide individual and group counseling service and crisis support on site as needed to the students. We also offer consultations to the teachers and the caregivers. In addition, we develop close working relationship with school counselors, attend the coordination of service team meetings regarding student referrals, follow-up, and service coordinations. We also provide roving mental health services to schools at which we do not have an intern placed, but have students who are medical beneficiaries who need the services and may not have access otherwise. In these cases, the city's licensed clinical staff usually will provide the service by traveling to the school from our YFS clinic. In the case that parents did not want to consent for services, or youth who were assessed as not needing or wanting individual mental health support, youth will be referred to their private insurance providers or community providers or other types of services as appropriate. Next slide, please. So the next slide is on crisis intervention and coordination services. So we provide students, with the crisis intervention coordination service through the city's mobile evaluation team and also our youth and family service crisis counselor of the day. So the city's mobile evaluation team was created in 2017 and is a collaboration between Fremont Police Department, Fremont Human Service Department, and Washington Hospital. The MET team is deployed by the police department to respond to mental health and or substance use or unsheltered related crisis calls for services Monday to Friday. The team is field-based with multidisciplinary members. It consists of law enforcement officer, a crisis intervention specialist, and a crisis nurse care coordinator. The mobile evaluation team is trained on mental health issues and crisis intervention as well as de-escalation. It also connects community members needing assistance with local mental health and other service providers. So the police officer of the MET team can also initiate an involuntary hospitalization evaluation. So if the individual is at immediate risk of harm to self and others, they will be able to support that. For students who might be experiencing imminent mental health crisis at the school site, then the school resource officer may be called upon to support that evaluation. On the other hand, if there are family relationship crises whereby the children and youth run away, not coming home at night, or refusing to go to school, or having aggressive behavior, Parents can contact the police and request a family crisis session held at our YFS clinic. And if during work hours, Monday to Friday, the police may also bring the parents and the youth to our office for a same-day crisis session. If after hours, the police may bring the kid to a safe crisis residential home for an overnight stay, and then afterwards, the next day, the kid will be dropped off at our site for a family crisis session. So also whenever possible, we also support the FUSD's crisis response coordination efforts as needed. Next slide, Annie.
Okay, so thank you, Joyce. YFS has many years of experience working with at-risk, now called at-promise youth and their families. We offer counseling and support to youth who are on probation, first-time offenders to divert them from the juvenile justice system, and students who are caught on campus committing an offense or having challenges with behavior and or school attendance due to truancy. In the recent years, just prior to the COVID pandemic, as Greg mentioned earlier, we partnered with Fremont Unified School District Student Support Services to develop an alternative to suspension program specifically for youth caught on campus vaping. This program has evolved to include students who are committing other non-criminal offenses. The program uses an evidence-based curriculum called Y-Try. This curriculum uses a cognitive behavior approach to help youth understand how their behaviors and actions have consequences and help them make positive, healthy decisions that will lead to positive behaviors. All YFS staff have been trained in this curriculum. Each year, Fremont Unified School District and Youth and Family Services work together to refer students to this program with parental consent. Students attend a series of 4-week classes facilitated, and upon successful completion, receive a certificate of attendance that is provided to FUSD. The students who attend this program gain skills, self-awareness, and avoid the risk of suspension and or down the line expulsion. They are also referred to services as necessary, such as substance use and or mental health counseling. Next slide.
I'm going to interject if we can wrap this up rather quickly so that we have time for our last speaker. That will be great. This is valuable information and we will share all of this afterwards as well. Thank you, Annie. Continue.
Okay, will do. I'll go as quickly as I can, Kathy. Thank you. As one of Alameda County Behavioral Health Care Services, 3 state certified drug, Medi-Cal, adolescent substance use treatment providers, we offer outreach and education to the community and school districts, as well as regular outpatient treatment, intensive outpatient and recovery support services to Fremont youth and their parents. Services are provided at no cost to the youth and may be received at schools, at home, safe alternative community locations, and at our clinic at the Family Resource Center, and via telehealth video conference if necessary. Currently, we have on-site services offered at Robertson and Kennedy High Schools in Fremont and Bridgepoint School in Newark. In addition to the individual and group services for youth, we provide a regular multifamily group for the parent and guardians of youth receiving services. We perform extensive assessment at the beginning of services, develop a plan with the youth, and provide drug testing services at our clinic at the Family Resource Center as necessary. Next slide. Parents and families are offered a variety of adjunct services by both YFS and the Family Resource Center case management team. The Family Resource Center, otherwise known as the FRC, is a facility in downtown Fremont that hosts 20+ government and nonprofit agencies and essentially a one-stop shop environment for people who are seeking social, health, housing, and financial services. Both YFS and FRC teams work closely with FUSD Student Support Services to link students and their families with services they may need and support. Case managers and clinical staff attend the cost meetings as well as school attendance review board meetings as necessary to support the individual students. YFS also offers free parent education classes, and as I mentioned earlier, a bi-weekly virtual parent support group in both Spanish and English. Next slide.
Go ahead.
Joyce.
Okay. So we also, in partnership with FUSD, we raise awareness of importance of mental health, student wellness, as well as to reduce stigma. And we utilize different mediums and contact-based messaging to promote the understanding and change of attitudes and beliefs. So as you can tell that we have YFS Instagram account, Fremont Youth Wellness, is filled with cool images and wellness, information. In addition, we also have been hosting the student art competition and exhibition in celebration of National Children Mental Health Awareness Day in May for the last 4 years. And the virtual art gallery, the link is there. And also on the slide, those are the winning entries for this year with the theme of coming together with hope. And with support of a mental health stigma reduction grant from Kaiser Permanente, we also launched a few projects that include our Youth Wellness Ambassadors Community Service Project, that 6 high school students were selected to participate. And through this project, they learn more about mental health and then develop the presentation to be shared with their peers. Blossom is a short film made with youth actors from FUSD that highlights the mental health challenges and associated stigma. The film aims to instill hope and highlights the importance of you reaching out for help. Motivate Cafe is a video show with interviews that inspire hope that mental health wellness and recovery is a process and is possible. For the Youth Mental Health Forum is held in December 2020 with expertise from New York University and also Kaiser Permanente and Fremont Ambassador to share the importance of mental health. All these art gallery information videos are available at our website. Please take a look. Next slide, and then thank you. Yes.
Thank you very much. A wealth of information. I can't believe how fast you covered all of this. Now we're going to go next to another county resource, Anissa Villarreal. And Anissa, please announce what your title is, what you do with the county, and then let's go through your slides, and welcome.
Thank you so much. Good evening. Buenas noches, everyone. Thank you so much to Supervisor Halbert and Kathy for inviting our agency to present. It is so good to be in virtual community with all of you. As mentioned, my name is Anissa Villarreal. I'm an assistant agency director here for Alameda County Social Services Agency, Government and Community Relations. I'm here to give you a brief update on public benefits and services that are available to the community. Next slide, Kathy. On average, our agency serves over 400,000 people per month. So let me say that again, over 400,000 people a month, meaning our agency serves a quarter of the county population on a regular basis. So in order to deliver our services efficiently to the community, our agency is organized in 3 main operating departments and 3 administrative offices listed here. Next slide. In an effort to be more transparent to the community, we recently launched a new website. This website is meant to be user-friendly and more accessible to our staff and clients. It also features enhancements like dynamic resizing for desk and mobile viewing. It's organized by service area and has simple interfaces. Currently, it is available in English and Spanish, and I invite you to check it out at alamedacounty.socialservices.org, and we hope you like it. Let us know what you think. Next slide. At the beginning of the pandemic, our agency was contacted by the Alameda County Food Bank, and they advised us that approximately 80 of their county-wide partners had shut down their food distribution sites. I serve as the dual role as the Care and Shelter branch chief for the County Emergency Operations Center. And in this capacity, we quickly mobilized to uplift 2 emergency distribution sites, one in Oakland and one in Pleasanton. Both sites were supported by county-wide emergency disaster service workers for more than 6 months. In the interim, our agency established an emergency food vendor pool to request for county contractors to distribute emergency food. Since September 2020, our agency has distributed over $100 million in emergency food contracts to over 26 vendors with over 700 partners. From September 2020 through July, these vendors have distributed over 3.4 million prepared meals, 43.9 million pounds of groceries and over 6.7 million bags of groceries. In addition, we established this emergency food testing and services map to quickly organize access and information to our clients and constituents. We update this emergency map on a monthly basis using information from cities and community-based organizations shared to the Emergency Operations Center. I invite you to click, this is a live link and you can click on it, it'll take you directly to this food map. You can also Google it at Alameda County Food Testing Services Map. Next slide. Last month, our agency created this informational flyer for staff and for clients to provide key details on 28 benefits or supportive services related to pandemic assistance. There are 5 programs that are directly administered by SSA. The Supplemental Security Income State Supplementary Payment, known as SSI-SSP, the Cash Assistance Program for Immigrants, known as CAPI, the CalFresh and Enhanced CalFresh, the Season of Sharing Program, and the Housing and Emergency Lodging Program, or HELP. Specifically, I wanted to highlight that pandemic assistance or CalFresh benefits were increased throughout the pandemic. So eligible households received the maximum amount of benefits available to their household, and in addition, received an additional 15% increase in those benefits. Since creation of this flyer, the USDA has updated their Thrifty Food Plan, which determines the level of benefits. SNAP, or the federal program, it's known to us as CalFresh, has since, it will expire at the end of this month or on October 1st. And the federal government is raising the average benefit by 21% for all households. So I invite you to check out this flyer. We'll send it out to you, Kathy, so you can send it out to the group and to all your constituents. And please feel free to reach out. Next slide, Kathy, with my contact. Feel free to reach out at any point if you have any questions or concerns. Thank you so much for the opportunity to talk to you tonight.
Kathy, please unmute.
Kathy, I think you're on mute.
Sorry about that. Okay, thank you very much. Record time for all those presentations, all that information. And I hope that anyone who is watching this tonight or in the future can see that we have incredible support for not only students, but families, caregivers, support staff, Fremont Unified staff. And I love that you really have included throughout the night, all the levels of staff for Fremont Unified. It's teachers, it's certificated staff, classified staff, and it's everyone who pitches in to make this all work and to make the students who come to school every day feel supported. With that, it is 7:01. Was there any last parting word that anyone had to say, perhaps from either Mayor May or Superintendent Kamick or Supervisor Halbert?
I was just going to say real quickly that I appreciate the partnership of everyone in this time period, whether it's the county, the school district, and certainly our own City of Fremont team. It's been really critical for us. That's why we've been able to keep people healthy, and we look forward to the continued efforts. To date, we are at about 96% single shot and 82.5% about fully vaccinated. But we wouldn't have been able to get to this in terms of the wellness and the ability to us to be able to build a better normal without all of your support. So with that, I just wanted to share my greatest appreciation to all of you, and especially all those who have worked so hard, and Supervisor Halbert, who, oh, there he is, who has been able to pull all of us together today, and Kathy, always for your hospitality and hosting this.
Supervisor?
Indeed, Kathy, let's close it out and say,
Yep, we're having a connection problem, Supervisor.
I can just say how impressed that I am with the coordinated effort of the partnership. I'll let you finish then, Kathy. Why don't you close it out?
Okay, I apologize for that. I know he is.
Go ahead and close it out, Kathy. Can you hear me?
Thank you. We can hear you. Yes.
I can hear you now.
Thank you so much, Supervisor, for partnering, hosting this, and pulling everyone together and allowing me to pull all these people together with and for you. And thank you, everyone, tonight for everything you do for our students, our families, and our community, and for your time tonight. Time is precious. And thank you very much. And we didn't get to any Q&A, but we will certainly be sharing this. And if we missed any Q&A, I will circle back with folks and email folks who were on the call tonight or on the who logged in tonight, and we'll share the resources with you past this evening. Thank you all and have a great rest of your evening.
Thank you. So nice to see all of you. Be well and stay healthy.
Mhm.
Likewise, take care, everyone.